Okay, welcome back to COVID Data Science Channel. I'm on a bit of a warpath right now over an article I just read a few minutes ago. I'll share the article with you right now before I run my COVID-19 report. Okay, there's an article I want to share with you. This is from an organization called The Hill. And as you can see, the report in question is from October 19th. The headline is, "The coming weeks will be the darkest of the entire pandemic," infectious disease experts say. Although after reading the article, I have serious doubts as to what his political affiliation is. Now, the story at a glance. We do have vaccines and therapeutics coming down the pike. But when you actually look at the time period for that, the next 6 to 12 weeks is going to be the darkest of the entire pandemic. Michael Otterholm, director of the Center for Infectious Disease and Policy at the University of Minnesota, said that the U.S. is suffering from a message problem due to the lack of lead voice to guide Americans through the pandemic. The U.S. reported more than 70,000 coronavirus cases on Friday. But of course, there was only, 300 and some, maybe 600 deaths on Friday, which is down from, anyway. I'll come back to it in a moment. What I want you to see here is this: negative, 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 basically thinly veiled attacks on the president. A top infectious disease expert is warning the next several weeks could be the darkest of the epidemic. Well, I like to suggest to you that darkness is measured by death. Okay, darkness is measured by death. In the U.S., cases cases continue to surge in many parts of the country. Yes, the cases have been surging since June. Okay, we do have vaccines and therapeutics coming down the pike, but when you actually look at the time period for that, the next 6 to 12 weeks is going to be the darkest of the pandemic. Our country is in historic fight against COVID-19. Well, I would say no, it's not. The swine flu, the Spanish flu, COVID-19 pales in comparison to the devastation of Spanish flu. We don't have bodies stacked up in the back room. We're not burying people in mass graves. So far, there's been fewer deaths. Fewer deaths over the last. There's been the number of COVID-19 deaths in the U.S. is half or three-fourths of the two or three major killers in America. Okay, so therefore, it's not really historic. You could say it's historic out of the last 100 years, back up to 1920. Well, no, that's not true because anyway, vaccines will not be available in any meaningful until early in the third quarter of next year. U.S. is suffering from a messaging problem, i.e., the president, problem to the lack of a lead voice. Maybe the problem is the people who don't wear, the people who are not going to wear masks. It's not going to make any difference what the voice says. Okay, a lead voice, whether the president or Dr. Fauci, isn't going to affect to any great degree the number of people who wear a mask. It's just as simple as that. It's like people who don't get flu vaccines. Okay? And experts safe and effective can. Okay, that's probably true. But anyway, but you got to set a goal, and that goal is January 1st. You may not make it, but you have to set a goal. Otherwise, you wander aimlessly. The U.S. reported about 75,000 cases on Friday, making it the highest single day increase from for the country since late July. That's true. That's also death spiked in middle of July. Look, cases cases. Below right past 65 cases. Again, that's true, 219,000 deaths. Finally, they mentioned deaths. That's the first time, although they don't mention that the deaths have been declining since July 16th. Okay. All they want to talk about is the big numbers, cases and total deaths. Okay, keep looking here. So that's the end of the article. But it's not to the very last sentence of the article does the word death, is the question of deaths even come up. And then they neglect to mention that the deaths have declined by 80 to 85% since the spike back on, was it, July 16th. That's not mentioned here. Now let's take a look at some numbers. Let's open up our thing here, and let's just run the report and take a look at some numbers here, and you'll see exactly what I mean. So far, the average number of cases is still 29,980. The average number of deaths is 932. Okay, the average mortality rate is, if this is 5, this is let's say 4% just to make it even. Well, if this is 4%, all these days mortality rate was less than the national average. Really? That's interesting. Anyway, okay, well, now, in the interest of full disclosure, yes, cases are increasing, but they have been increasing. They have been increasing since, say, June. And I don't see any reason for them to slow down. This blue line, shaded line here, is the 17 to 21 day incubation period mentioned on the University of Washington Institute for Health Metrics and Evaluation website. Okay, so these people here are the ones at current risk from death. All these people here are past because this line moves to the right. Okay, so all these people back in here are, weeks out. Well, again, this is April. All these people say between April and say September, these the deaths associated with these spikes should have already been taken into it, should have already occurred. Okay, even if you say, well, there's a 6 week lag. Well, okay, that's fine. This is about 6 weeks. What about these here? Where was the spike in deaths back for these groups? Now, let's look at deaths by day. Here's what they don't want you to know. He mentioned deaths. The number was correct, but he neglects to mention that the uh, that the deaths have been decreasing since this spike back up here. And even if we kind of use a daily average or an average number of deaths per day, you can still see it's been steadily declining from here. Okay. Again, let's zoom in on cases at the current spike. Again, here's that incubation period. Where is the deaths associated with this spike right here? There's obviously something else at play here because deaths are decreasing. And if we're not, if we're, and I personally believe, like I said before, the number of people wearing masks isn't going to change regardless of what anybody says. Okay? But yet, deaths are decreasing. Okay? Deaths are decreasing. Now, yeah, this is not good news. This is the average number of cases per week. And yes, we do have a huge mass. Once again, look at this spike in cases back over here. This is July. Here's June's, July. maybe August. Okay, August or May. But look at this spike back over here. Where's the death associated with this spike? I believe they've already occurred. But look at now look at this. If we look at the average number of deaths per week, this red line here, look at all the weeks when the deaths were below average. Oh, wait a second. I don't see, and yet the article makes no mention of that. Because that's not this organization or that news agency's mission. Their mission is to mislead you by not giving you all the information you need to understand what's really going on. Look at cases by month. If you look at by month, you see that the cases are actually decreasing. That's kind of strange. Okay, what about deaths? Well, look at deaths. There was a slight spike here. That the increase in deaths was nothing to compare to the increase in cases in terms of magnitude. But look at this. There are fewer deaths in September than there were in either July or August. But that wasn't mentioned. And this isn't really I'm sure this is a particularly useful chart. It's interesting to me. The red line is a 14-day. This is a 14-day moving average of deaths. Deaths are 14-day moving average. The blue line is a 30-day moving average for deaths. So that's not particularly useful. I just found it interesting. So anyway, my message to you is this. The sacrifices you and me are making, wearing masks, practice social distancing, avoiding crowds when possible, is making a huge difference in the number of deaths. Because the deaths again have been decreasing since April, since what? That's a good question. Since July, deaths have been declining since the middle of July. And how can that be when cases are surging? Mask? I don't think so. Maybe there's a less deadly strain of the COVID-19 out there. And the final question is this. How many deaths, COVID-19 deaths, is acceptable per year? Well, if we look at the deaths of other killers like heart disease or respiratory things or something like that or cancer, well, it pales. It pales. Yet there's no panic, there's no hysteria over the couple 100,000 heart disease deaths or heart and lung disease deaths or cancer deaths. Where's the panic in the media? Where's the hysteria from the news media? Okay, that's enough of my rant for today. Thanks for spending some time with me, and I hope this report has encouraged you to continue to fight the fight. Okay? And we will beat this disease before we even have a vaccine, I believe. So thanks so much for your time. We'll catch you on the next report.